Beautiful. Okay. Okay. Beautiful. There it is. There you go. Fast. Ooh, yeah. I don't think anybody else has gotten that, Ed. You're the best. Thank you.
Yes, that was really good. The neck area.
Right side of the neck.
And then the lower back are the two main issues today.
Anything in the shoulder blades in between here? Nothing there, just lower back. And then you said the hip a little bit too?
Right in here.
On the front part of the hip. One deep breath in for me. And then let your air out for me. Exhale. Let it all go. Here we go. Real gentle. Deep breath in for me. 2 more. Let all the air out. Exhale. Deep breath in. There we go. I got you. 1 more. Exhale. Let it all go. Yeah. Reluctant. It's moving, but pretty tight in there. Bring this hand on your belly. Deep breath in for me. And then exhale. There we go. Exhale, twist. Yeah, we gotta get you loosened up. Here we go. Exhale. There we go. All right, other side for me. Beautiful. Take a deep breath in for me. Exhale, twist. Good. Breathe. Exhale. All right, face up for me. Face up. So I call it coercion. All the vertebrae should move on the first adjustment. I use the soft tissue work to get things to move properly. Let's say the joints moved at about half of what they're capable of. And so instead of just giving up and saying, see you tomorrow, we're gonna work the area a little bit. We generally hurt in areas because parts of our spine are overworked and then parts of our spine are underworking. And so I'm just gonna go through your spine a little bit and see if I can find where the tightest parts are and unlock them a little bit. All right, let me feel here. Bit of a lump right here on this left side. All right. So it feels like the left side is really tight over here. And then what happens is the right side typically then has to compensate and work a little harder. I'm going to see how it feels to adjust it. There we go. It's already moving a little bit. There we go. I got you. Beautiful. Okay. Okay. There we go. I got you. Chin up for me. Oh, I got you. Wow, a little tight over here. Yeah. I got you. Yeah. We have work to do on that left side. Do you get the idea? Your right side of your neck did everything I asked and more. And that's why it's probably not feeling very good because it's really loose over there. Do you feel the difference?
Yeah.
This left side it basically stuck its tongue at me. Who do you think you are? Wow. Really tense over here. And so I know it's like, Ed, no, my symptoms are on the right. I told you, it's all on the right. I know, but the right's kind of like a sprained ankle. It's just overworking, and that adjustment made it pretty obvious where your tight area is. It didn't even move on a medium throttle. I upped the throttle a little bit, and it moved one bone. And so, okay, I barely touched the right side of your neck. Okay. What's going on here? Why are you so loose? There we go. There we go. Just trying to unlock this left side a little bit. Yeah. Starting up here, it's really an avoidance of the left. Your neck doesn't like to tilt to the left as easily as it tilts to the right. It's like a car tire, or a car. It pulls to the right. It doesn't drive straight. So it's an alignment issue that causes mechanical overstressing.
That's why I'm here with you.
I'll fix you up. You're in a good place.
What he's doing right now, I haven't had that done from a chiropractor. It's kind of like, I'll tell a massage person like the pain is on the right side and they'll focus on the right side. No one has ever really focused on the left.
Right, you're just further loosening what's already loose. It's hurting because it's done too much. It's not hurting because it's doing anything wrong. It's just doing everything. I'd almost say we should almost focus on just the left. Oh boy. I know, but it hurts on the right. I know, but the right's just being beat up. Sometimes the areas are so tight that they sort of choke off the blood flow from being able to perfuse into the tissue. And so that creates a lot of lactic acid and then a lot of soreness perhaps in these stiff areas. So we're just trying to untangle these. You're doing great. Perfect.
How does that feel? It feels good.
Way better than his thumb. I know.
At this point, I don't even feel pain when I get these things done. I've gone to massage therapists and walked out and they apologized to me. They're like, I don't think we got to what your issues were.
Aw.
So I'm a tough cookie.
This is the curve that your neck should be in. This is what the opposite of what when you're working all day looking down or even looking just straight forward. We're supposed to have this arch in our neck. And so the first phase of care is to get your neck pliable and soft like clay so we can sort of reshape it back into the right position, which is arched. If your neck was arched, the weight of your head would be more evenly spread over all the segments and there would be less chance for pain. You want to get the alignment fixed instead of just focusing on just adjusting and, making people feel better for just a few days. We want to go long term. Let it go. I know, I'm waiting. Gotta get this side unlocked here a little bit. Oh boy, yeah. I'm gonna rub this right side a little bit, take a break from that left. That's the cause. There we go. Just trying to get you back here.
Yeah, that's really uncomfortable.
Right. It's where your neck, well, the joints have a lot of feeling, and that's why your head's gone forward, and that's why the joints are inflamed on the right. It's because they've been, all the weight's on the disc, and then over time the disc ages, and you've probably heard of disc bulges or disc herniations. That starts to happen in the late 30s, 40s. People wear out the cartilage in their spine because they don't have the curve in their neck. That's why it's important to restore the arch, ultimately for the disc's health, but the disc doesn't have any feeling. The joint has all the feeling. So what I'm doing right now is I'm putting all the weight onto the joint, and it's just not very comfortable. But the joint will last a lot longer than the disc. Enamel on your teeth doesn't have any feeling yet. It's very valuable. The disc doesn't have any feeling either. Go back to the side of your favorite side. I know. Oh my. Right there.
I just hope I'm not hurting you.
Oh gee. You're doing good. You're doing good.
He's got
All right. Want to go a little deeper. If it's too much, let me know. Here we go. There you go. To make a neck Denneroll, basically took a mold of my thumb. Right?
And your thumb.
Well, basically. Right? See? And it holds you.
Yeah.
It holds you in the. Remember how I had you on your back and you were like, don't like that too much, Ed. Right?
Yeah.
Well, we have to. You make me do all the things I don't want to do. You don't. Do we need to work on the things you're good at or work on the things you're not good at? Right? It's like I'm like a math teacher. You already know fractions? Well, let's keep doing fractions. You're already good at it. You don't need to keep working on it. You need to work on algebra and these other things that you're not good at, right?
Yeah.
So I already know you're good. I've already seen the stuff you're good at. We don't need to do that. We got to work on what you're not good at, which is you've lost. This should be an ease. This should be a joke.
No.
Well, let's try.
Oh.
It's just a portable thumb and just holds your head. Let your chin go up a little bit. There you go. And then let your legs go straight. Yeah, there you go.
Yeah. It's
Yeah.
uncomfortable.
Right, well. That's why you're here.
Yeah.
That's the left side of your neck I'm still thinking about. I know. Uh-huh.
Are you?
Are you really thinking about me? I'll go home tonight. My left side of her neck was so stuck. I do. I'll remember people's spines more than anything when I'm working on. I'm like, yeah, left. It was just the difference between the ease of the right side, and it was, the right side moved so willingly and the left side moved so reluctantly. That disparity is what. See, if both sides were stiff, at least it's symmetrically stiff, right? At least it's symmetrical, right?
That's how you see it.
Right, it's not moving, which is bad, but at least it's symmetric. Yeah. I'm like, I got you. I'm gonna lift your head there. Lay your head back for a second. Breathe, and then when you're ready, come on up. Let's try that neck. I'm gonna be greedy. Unlock this side. That's the last thing I do. Yeah.
I appreciate that.
Now a challenge. I'll consider you a legitimate chiropractor if you can. Oh, jeez. I'll get you. Left side. I will. I'll be like it up night. Like, I didn't get it, Carl. Am I a good husband? Am I a good chiropractor? I tried hard. And down. I'm waiting. There it is. There you go. Yes. Ooh, yeah. I don't think anybody else has gotten that, Ed. You're the best. Thank you.
Yes, that was really good.
Good. I got it. The left side is real, same kind of story as your neck. Real powerful over here. I feel maybe everybody's been working on the wrong side of your back.
Yeah. They hear me complain about the right side.
Right, You almost got to tell him it just feels tight on the left and tell him to focus. We only feel the areas that are sprained. The joints have a lot of feeling, and the local pain, where you're able to point to it so accurately. You understand, when you asked you to point to the pain, you're like, it's here and it's here, right? That's joint. If it was in your knee or down on your foot, now we're dealing with the nerves that come out alongside of the spinal column. But because it's so local to your spine, that's really the joints, and we hurt in the joints that are overworking, and we don't hurt in the joints that never show up to work. This feels real soft on the right, and then right over here. Either that or because all the treatment's been on the right, they've really softened up your right. And now we got to spend some time unlocking this. I'm going to keep going deeper and deeper until I see a fist made out, or, start trying to hit me or something. I'm going to keep going deeper and deeper. If I get any. All right. But please don't, Ed, back off. I try to ride the edge of what you can handle.
Or if you need more, tell more.
Or more, yeah, that's fine. Oh, up to my limit. Harder! That's all I've got.
Walk on her back.
I can't push any harder. Is that all you got, you little chiropractor? You? Come on. That's why sometimes I have my father in my back pocket. I'm like, I'll bring Bo in. I'll bring him in. I'll bring my father in. He's bigger than me. How many hours on average would you say you sit a day, including car and dinner and work?
So I work from home. So I get up and probably on the computer until from 8 to 8.
Okay.
So, yeah, at least 12 hours.
At least 12 hours just doing work.
Yeah.
Let alone relaxing or driving places and right. So that has to be counter-stretched. There's no amount of massage, there's no amount of adjustments, acupuncture, lasers. There's nothing that will counter that. And so my goal today is sort of to lay the foundation for understanding how do we start preventing this from getting worse at the very least, and start treating. It's ultimately your posture which defines the pain. The pain is a result of the posture shifting.
Am I hurting your elbow?
She's so considerate.
She needs more.
Get you. Am I hurting your elbow? Get you.
Call your father.
She's too tough.
No.
Am I hurting my elbow?
That means go more.
I've had deeper massages by. Get you. I'm strong. I really am. It's so funny because I've had the last few videos have been guys, and guys are the biggest wusses. They are. Right, Carla? They are the biggest.
Women are way tougher.
Women are always. All my top, toughest patients in terms of tolerance and pressure, they're all women. I might have found a spot there a little bit. Okay, all right.
Do you feel better?
Yeah.
It's the most
are human.
most passive yeah of all time.
It was good, actually.
Yeah, I feel it. Oh, here we go. Oh, now we're starting? I'll get you! All the guys on YouTube are like, he's not pushing that hard.
No.
He's going gentle on her. He's lying. Those guys he was just being really mean to. He just cares more about her than those guys last week.
Yeah, you had some good ones last week.
Well, like I said, I got
Did you
these.
see the MMA fighter?
Yeah.
So funny.
Well, no, I'm pushing on you way harder than him.
Yeah.
It's funny when I watch you do these on the show. Everyone's back turns out so red. Now
Yes.
I understand why.
Right.
Although it's not painful,
Mhm.
it's still like you're working it. So.
Get you. Might have met my match on this one.
I'll let you know when the camera goes off.
Okay, fair enough. All right. Right. I was this close to puking. area, yeah, back of the rotator cuff. Oh yeah.
Yeah, I was pretty sure that my shoulder was broken,
Oh man.
but it's not. They were just like, no, just tie it.
Yeah, just rounded this all forward. All this is. The weight of your body is supposed to end on your heel, and when you sit, it doesn't go to your heel, it ends in your tailbone, and so it all ends right down here.
Oh, that's interesting. I didn't realize that.
Right, so you don't have that. It's supposed to go across the iliac crest, down the femur, down to your heel, and that's kind of where the weight's supposed to transition to. And when we sit, you take the legs out of the equation, and so this becomes your heel, and that's why this area gets so upset down here. And the arch in the lower back being straightened by sitting adds to this. It adds to the weight transfer, whereby you don't have your middle back assisting and just the lower back's doing 5 times what it's supposed to be doing, and rightfully so. It's not very happy about that. Not very. Oh yeah, sure, I'll do my job and his job and everybody else's job around here. Sure, why not? I'm not going to be upset at all.
Yeah, that feels sore.
Okay, finally. Oh, there we go. This is probably the left hip. In order to feel that pain that you said was wrapping around to the front there, that comes from an overstressing. So this is going to be your opposite. And there really isn't a huge amount coming out on you. You really just need posture change now. It's just, she's really just ready for stretching.
It feels good though.
Yeah, we're just going to clean you out a little bit. Right there's a little bit around this 12th rib.
Yeah.
Right there, yeah. Little QL attachment here is a little inflamed. Yeah, right there. It's probably the one. But you really can sort of leapfrog and jump right to the stretching. There isn't these large swaths of bruising and soreness back here that's going to prevent us from getting far. You're ready, like right here, this all has to go in about an inch, but it's just got to be stretched now. It's all loosened up enough to stretch. So you're supposed to be here. Your upper back is sort of here. So when you're laying face down, this is more rounded. And so what I mean by an inch is that this right here has to go forward.
An inch
To get your, see, the head goes forward in response, well, they call it couple motion. The head goes forward and the chest goes back. So the alignment, when you're laying face down, your head is still wanting to go forward, and this is rounded up here. And so the main purpose of the adjustment is to get it loosened up so that we can stretch, and we'll see in a second. I'm going to see how deep I can ask you to stretch back to align this from the side. So the ear should be over the shoulder from the side, and because of our work, and that's what I was saying with the elbow, you want your arm at a 90-degree angle here. The more forward your shoulder goes, that's why this is so tense back here. Does that make sense?
Yeah.
And then even the neck pain happens because of that constant joint inflammation from the position. So we adjust, massage to get your joints like each other, and then we stretch back. When I hold your head curved and you're like, Ed, that's uncomfortable.
Yeah.
Even the position you're in right now is really good for your body. When you're relaxing or reading or on your phone with somebody, you should be really on your belly, arching up. Get the idea. This is the opposite position of what you're used to.
What is this, cobra pose?
Like cobra pose, yeah, very good, yeah.
Do you
This
do
is
yoga? Nice.
Yeah. There we go. Okay. Here we go.
Oh, that felt awesome.
Interesting. Yeah, the right. Notice this. I couldn't get this toe to move over here. You like to stand on your right side. That's why you get the difference. This is all jammed up on this side. This side's all moving properly over here. Oh, I got you really easy. There we go. Wow, nice.
Yeah.
Bring your sort of press back a little bit with your elbow. There we go. Good. There we go. So put your hand there on your hip. There we go. Sort of press back a little bit here. There we go. Good. All right. You're right here a little bit. All right, I got you. Tilt your head a little bit left for me. There we go. Good. Uh-huh.
Oh my gosh, it's like my ear is releasing.
There we go. Tilt your head a little bit to the left for me. Good. There we go. Tilt your head a little bit to the right. Go again. There we go. And tilt your head a little bit to the right for me. Okay, that's good. All right, come with me.
Oh, that hurts. That's where all the pain is, right? Mid-back.
Right. We have to stretch. This is the one component that you've missed. This is the only. You're really prepped for this. You know, instead of sitting like this.
Oh, that's my favorite.
Right. Well, this is no amount of chiropractic is gonna. You roll down. There you go. We get the idea. No amount of chiropractic is gonna fix it. Your posture, because if you're sitting like this for 10 hours or 12 hours, and then you stand up, your body retains some of that position, right? So we belong back here, and a large group of chiropractors are teaching that we need to strengthen our muscles to hold us upright, and I don't find that to be practical. Your muscles can't be depended on to hold you upright. You have to stretch back, that makes sense, to make this where you want to be. So that's really all you've lost. You've lost your ability to